Hi, everybody. I see people starting to filter in, and I see some comments about the audio. Hopefully you can hear me now. We're just going to give people a couple minutes to get settled in, get logged into the webinar, and then we'll get started in just a minute or two. Thanks for your patience. All right, why don't we go ahead and get started? Make sure we'll still have some people filtering in, but let's make sure we use our time well today. Thank you all for joining us for our community engagement forum today. Just a little bit to get people oriented to who we are and what we're doing today. This is a quarterly forum that we co-host between Accords and the Community Engagement and Health Equity Core of the CCTSI. And today our topic will be focusing on the community engagement, partnership development, and pilot grants out of CCTSI, and we'll be digging into an example of that. As we get started, just a little bit from the slides you saw as we were letting people get settled. Accords is our pragmatic research in health center here on the Anschutz campus, and we provide a number of services to faculty conducting pragmatic and engaged research, including our methodological cores, consultation services, partnership, and a lot of educational opportunities such as this forum. And then we also have our CCTSI Community Engagement Core, which focuses on faculty and researcher development, as well as community partnership development. We have some upcoming events. So first is our next community engagement forum. If this is a space you are interested in continuing to learn more about, is in July. I believe it's July 26th. And then we have a few seminars that you can learn about on our Accords Education website. We have a mixed methods series happening right now, and we have an upcoming topic on mixed methods designs, as well as our health equity seminar series this year. And we will be looking at federal funding in health equity spaces with Dr. April O in just a couple of weeks. So information about those are on our Accords website. And then we also have, there's one more save the date in our slides there that I am forgetting to share, but we'll make sure we have some of that. Thank you, Jordan. CopperCon is our other upcoming event, June 5th and 6th, which is our Pragmatic Research and Health Conference, 2 days, and we are very focused in community engagement, community partnership, and health equity this year. So we hope that that's something you'll consider joining us for in June. Today, like I said, we are focused on our CCTSI Community Partnership Development and Pilot Grants. And I'm going to hand over to Kaylee Gordon, who's Program Manager for CCTSI Community Engagement, to talk a little bit about those grant mechanisms before we introduce our speakers today.
Thanks, Sarah. I'm going to quickly share some slides. This shouldn't take too long, but I will say up front, I'm always happy to chat more about this if anybody wants to contact me and ask any additional questions. But I will be talking about the Community Engagement Pilot Grant Program that we offer through CCTSI. We do have 2 mechanisms, and we typically put out an RFA every year. So continue to be on the lookout for those. And I'll make a quick plug that if you want to be the first to know, you should sign up for our listserv, and you can just go to our website and join at the bottom of our page. So the goals of our specific pilot grant program is really to bring community academic partnerships together and support the studies that are going to strengthen those relationships, and also produce preliminary data for future other competitive grant applications. One of our main goals is to build capacity both in community academic partnerships, really to conduct translational research, and we focus highly on community-based participatory research. We like to see all grants that come in around community engaged research, but as many of you know, and what we've talked about on this call is that CBPR, or community-based participatory research, is sort of that gold standard that we're all striving towards. So we love to see when the grants come in really utilizing those principles. We do currently have some focus areas with our pilot grant program, and we are addressing health disparities related to childhood chronic conditions, social, emotional health, or cardiovascular disease. We also have had a focus on COVID-19 the past few years. And these areas don't mean that you can't apply with something outside of that. They're just kind of a little bit of a place to focus in, if you will. So to talk a little bit more about CBPR, it really goes beyond that traditional research in all the phases, from design to dissemination. And it utilizes that full participation of the community, and it's identifying the issues that are important to community and then working on those. It's not necessarily the academic coming with their idea and approaching a community partner about what they think is important to study. Additionally, this serves as a place where the community can help design and implement the instruments and different interventions that are going to be used within the community. The best thing about translational research is you can take something that maybe has worked in different populations and take that to the community and have them revisit it. What would this look like in your community? Tell us how we should adapt this. So that's the focus of the joint pilot projects, which I'll talk a little bit more about. And lastly, within CBPR, really the point is to have community, as I said, involved from design to dissemination. And sometimes dissemination can get forgotten or is perhaps given a little bit less priority. And so CBPR really re-emphasizes that community needs to be part of that dissemination. It's not just about posting or publishing, academic papers or doing a conference presentation, but how will you get those results back to community in a way that's meaningful for them? In the interest of time, I'm going to skip this slide a little bit, but just to orient you that our specific pilot grant program really focuses on the T3 or T4 areas within the translational science spectrum. So this would be projects that are going to be focused on clinical practices, family practices, or in the T4 spectrum within community and in population level. We don't fund research in the 3 prior, T0, 1, or 2. Our application categories, the first one is our partnership development grant. This is really intended to support new partnerships or ones that are right at the beginning stages. And it is a 9-month grant, and we award up to $8,000 that would be divided between the community partner and the academic partner. And I should back up and say that with both of our grant mechanisms, we ask that you apply as a partnership. So you're both completing, the application forms, you're writing together, you're determining the budget, everything is hand in hand, and you would have an academic co-principal investigator and a community co-principal investigator. This grant is really a unique grant is the way that I like to think about it, because there's not a lot of money out there that's offered to just kind of have that time to build the relationship. A lot of other grant mechanisms, want to see different outcomes or maybe something a little more harder with data, but we have really formed this to be an opportunity for you to spend time together, explore what the community needs are, understand where you might be able to do a pilot project in the future. What are the emerging needs that you can work on together? That's sort of what this slide covers, some potential activities you could do within this. Again, just building that relationship, exploring what those needs are and how to build that capacity. You may choose to start developing an advisory committee or another infrastructure that makes sense for your partnership. And then potentially developing that plan to apply for either our joint pilot project funding or other funding that you feel would be a good mechanism. Our second category is the joint pilot project. This is a 12-month grant and it's funded at $25,000. Again, that would be divided between the academic partner and the community partner. And this is really intended to support experienced partnerships. So this would not be a brand new partnership coming together for the first time. They've typically had a little bit of experience together. They're experienced researchers or junior investigators who have formed these partnerships with the community and have a clear idea of what sort of pilot project they would like to do. So potential activities that you could apply for and work on within this mechanism would be testing the feasibility or the adverse events of a study design, implementing a small scale study so you can obtain data and apply for larger funding. You could use some of this time to develop proposals for the larger funding mechanisms and also disseminate and translate research findings. Just a quick note of things we don't fund, projects with no community engagement. Hopefully that's inherent within this. We don't fund projects that are intended to find that health disparities exist within a project. We really want to fund projects that are going to support the improvement of health equity, access, all of that. We don't fund anything outside of the Rocky Mountain region. And we don't currently fund academics who are postdocs or postgrads. So I won't go into all of this. All the eligibility will be within the RFAs that we release, but really it's just stating that you have to be associated with the CCTSI if you're an academic, and then it kind of gives a definition of what the community researcher could be. Here is my contact information, and as I mentioned, you're more than welcome to reach out about any questions you may have. I'm happy to touch base about this. And I would like to share that this is relevant to today's presentation because we have Dr. Karen Barrett and Kimberly Penny here with us, and they actually were awarded both a partnership development award and then went on to a joint pilot project. So they've sort of seen the full spectrum of the pilot grants, and they have an amazing project they're going to share with you. I also want to share that they, I believe it was their joint pilot happened right at the height of COVID. So they've experienced various challenges and how to navigate that and come out on the other side. So I'm excited to have them here with us today. I will share Kim. She is currently the Director of Foster Care and Family Support and Education for the Northern Colorado Division of Lutheran Family Services, Rocky Mountains. As director, Kim oversees domestic and unaccompanied refugee minor foster care, individual and family therapy services, a supervised visitation and safe exchange center, as well as prevention programs, including parenting classes for adults and body safety classes for children. Kim received her MSW from Denver University in 1996 and has been an LCSW since 2001. She has prior experience in counseling adolescents at Fort Logan Mental Health Institute and Excelsior Youth Center's residential facility, and she provides ongoing casework with children and adolescents for Arapahoe County Department of Human Services. And Karen Barrett is the professor emerita, I hope I said that correctly, of Human Development and Family Studies at Colorado State University, and a professor of Community and Behavioral Health at the Colorado School of Public Health. Her research focuses on the impact of family and culture on the development of emotion, regulation, and motivation, and more specifically on how trauma impacts these processes. Karen received her BS in Human Development and Family Studies from Cornell University and her MA and PhD from Denver University in Psychology. And I am very excited to hand it over to you and hear your presentation. Thank you for being here.
Well, thank you for that great introduction. And I'm going to go ahead and share my screen now. And let me get it in slideshow. There we go. Okay, so the name of the project is Tapped In, and it is a parent-to-parent mentoring program. So what were our goals of this program? Tapped In stands for Teaching Adoptive Parents Trauma-Informed Parenting. And it's a university community partnership that is aimed at addressing post-adoption needs of parents who adopted a child with a trauma history. So, you know, parenting can be hard enough, and adoptive parenting even harder, but particularly that is going to be more challenging when the child that you adopted has a history of trauma. Our CCTSI partnership development grant supported our development of our expectations and a working relationship for our partnership, the partnership between Kim and I. And in that initial grant, we had an additional collaborator, Orsi, who is now at the Kemp Center. So it helped us in developing that relationship. It also helped us to do needs assessments that would inform our development of an evidence-based, trauma-informed preventive intervention to really and truly meet, as expressed by those community members, the needs of those post-adoption adoptive parents. Based upon our needs assessment results, then we obtained some funding from Dave Thomas Foundation for Adoption to develop the mentoring program in order to meet those needs. And then we got the partnership grant from CCTSI to actually implement that program. So what were some things that we made sure to include in our applications? Those of you who are hoping to apply for these funds, hopefully these are some things that may help you in figuring out what to include. So one of the things that was really, really important, I think, is clearly establishing the need for the project. So why this population? Why did we choose this particular population? Why is that you know, someone who otherwise might not receive these services? Oops, go back. Why is this approach the best approach? And how does it serve underserved high-risk populations? So the health equity aspect. In terms of those things that Kaylee was talking about before, it's health equity, and it is for socio-emotional kinds of health. The other thing that we really wanted to talk about is how we were going to establish a strong collaborative partnership with mutual respect. And, we already started with mutual respect before we got involved in the project, but that partnership development grant helped us in further learning who each other was and developing that relationship. It seemed like one of the things that was really helpful to us was that we had lived experiences that were pertinent, and we were really passionate about the area that we were going to be researching together. So I actually am an adoptive parent myself, and Kim was adopted herself. So we had that lived experience to draw upon as well as our professional backgrounds. And our research was really informed by that lived experience. The other thing was that we really were able to draw upon each other's expertise. So we both really respected that Kim was the one who really had the hands-on clinical experience with this population, and she knew lots of their stories and lots of their needs, and that was really, really valuable. And in contrast, my background made me have greater expertise when it came to research design. And so we really respected that the other one was the expert on their particular domain. We did really meet to collaborate on the application before we ever submitted it. So it wasn't just something where I wrote it all up and Kim just checked the boxes. We really talked about it, and we were each informed by the other. And we also really said from the start that we wanted to learn more from the population. So Kim had her experiences, I had my experiences, but we wanted to hear from a larger sample of adoptive parents than just those who were served by Lutheran Family Services or certainly our personal exposure. And so one of the things we built into the grant was the needs assessment. And another thing, oops, just can't touch anything without it deciding it's going to go forward. The other thing that we wanted to make sure to do was to right size the project. These are kind of small amounts of money. And so it's really challenging. I know I can speak personally. It's challenging for me as a researcher because I know proper research design and I want to do everything, and you just can't. So you have to really think about what is the most important thing to do, and how can we use these funds in a way that's really helpful. So what did we do in our mentoring program? We trained experienced adoptive parents who did have a child with a trauma history to serve as mentor parents for other adoptive parents. And our needs assessment included focus groups that really led us to believe that those would be the best people to be providing support for the other adoptive parents, other mentor parents. We did a training, and one of the things that we also found out in our needs assessment was that trust-based relational intervention seemed to be the one that the adoptive parents found to be the most helpful. And so we wanted to include some modules from that. And thank goodness, Lutheran Family Services had a certified TBRI professional who could do that. So we were able to avail ourselves of her help in presenting those particular parts of the mentor training program. Another thing, I have a developmental psychology background, and so we really put an important developmental piece in this. So what the needs are of the children will, of course, differ at different ages. And so we created toolboxes for the parents who were faced with parenting children of different ages. So, you know, it may be that even if you adopted a child at birth, that when that child is young, they're doing really great and you don't really have many indicators of that traumatic history. but then all of a sudden at adolescence, it emerges. And the literature really supports that that's not just an idiosyncratic thing that happened to this person. It's something that happens to lots of kids, that, you know, there are all kinds of genes that get turned on and so on in adolescence that may be responsible for that. But even if you feel like as a parent, you've done a fabulous job and you've had great success, sometimes that gets called into question when the child hits adolescence. It's kind of like usual adolescence on steroids. So the other thing that we wanted to do was to incorporate that trauma lens. And in addition to that, a relationship lens. One of the things that TBRI really focuses on is that relationship lens. And it seems particularly important for this population. And then the other piece is a race cultural lens. One of the things we discovered is that transracial adoptions, which are very common, receive a lot less support, and there's a lot less information about what to do there. And so that was one lens that we thought would be valuable. The other thing that we really learned from the focus groups and wanted to incorporate is validating both the parents and the children's experiences and needs. There tends to be more of a focus on the children's needs, and really the parents have needs as well. And supporting emotion regulation for both the parents and the children, because when you have a child who's showing really extreme behavioral difficulties, and that was another thing that our needs assessment showed us, was that over 90% of these parents' children were reported to be in the clinical range when it came to behavioral problems. So these kids provide a pretty stressful parenting experience. And so the parents need support as well. And incorporating mentoring best practices. So these parents are kind of mentoring the children, and the mentors are mentoring the parents. And so that mentoring perspective is a really important one. So in terms of the needs assessment, the results that informed that mentoring program included these. Most of the foster or adoptive parents had at least one supportive family relationship, so that was really great and important. But 60% also had at least one social relationship that was really unsupportive. So not just wasn't fully supportive, but was truly negative. Many of the parents felt judged by their friends, their relatives, and their strangers regarding their parenting, their child's behavior, and even the child's ethnicity. And although most parents reported one or more helpful professional or professional resource, the majority of them also reported at least one unhelpful professional. And so this really has important implications for practice, that a lot of these parents were finding a lot of their providers as being unsupportive, being actually, you know, kind of acting like they were responsible for their children's behavior, and that it was their fault that their children were struggling. Many professionals seem to be, according to the parents, judgmental, or they lacked the experiences that they needed to do the job they needed to do, or often they just had too large of caseloads and so on, and so they were just overwhelmed and unable to meet the needs of the parents. Some lessons that we learned from this, and I think, Kim, isn't this where you are going to be joining us?
Yeah, thank you so much. So lessons learned, always very important to look at. One of the main things that I enjoyed about our experiences is that we got to meet right at a little coffee shop right by CSU. And I was the one who wanted to come out to campus. Dr. Barrett would travel, but I said, no, it's so beautiful up there. So we met as often as we could before COVID happened, and we met in person. That's where we learned that I was adopted, that she was an adoptive parent. There was a student that had been adopted and another researcher that was an adoptive parent. So we created this safe space where we could be vulnerable and talk really openly about our lived experience, which was wonderful. During those meetings, we also invited an advisory group that we formed to join us regularly. Those were 4 parents who had adopted from our foster care system here at Lutheran, and then 1 therapist, the TBRI practitioner, who also specialized in private therapy with foster and adoptive youth. And for us at Lutheran, about 30% of our kids that come in as foster youth end up being adopted by Lutheran, their foster parents. Um, and so those were really meaningful experiences, and I think those in-person meetings helped us weather the storm that was COVID, when we now can only see each other virtually. We had spent a lot of time together, even just driving down to Denver to have focus groups, and really just breaking bread. A lot of humanity happens when you're in a coffee shop waiting to be served, and everyone's there and it's crowded, and you can just see people really lovingly talking to, Karen, or maybe I run into somebody, or we're just chit chatting. A lot of rich relational things can happen in those moments. So my advice to anybody doing this project is to meet in person, even if it would be real easy to do a Zoom meeting. Meet in person and really get to know each other and really get to trust each other. Recruitment was a challenge, definitely. We thought we'd have outrageous numbers that we would never be able to, manage, because they would be so massive. Um, at Lutheran, we're the largest, or maybe the second largest, child placement agency. And so we have 150 kids in our homes at night, and we have many foster homes. And so we had to learn to be happy with the people that showed up, even though we thought we could have gotten better numbers during a non outside of a pandemic. So that was a challenge. Also, highly stressed families felt overwhelmed during that time, and then, as we all know, it really didn't recede. So it was the recruitment and even just retaining people. And we're still seeing that in our in our world of foster care, where people people can take care of their own families, but not always open their doors to others, which could have a negative impact on adoption. So we're coming out of it, but it still exists. That fatigue still exists among foster parents who hope to adopt. Um, Persistence, just don't give up. That's a really wonderful rule. If we thought we might have a rich number of participants in one group and we didn't let it bother us for long before we were searching with our advisory group, with each other, for more participants. And so we just never gave up, and those people that did participate, I think, benefited greatly. And I know that Karen and I think, that we did too. Um, and then being a community partner, it's just very beneficial for community partner to have access to academic people. I have a lifelong professional friendship with Karen now that just wouldn't have existed. I don't know how we would have really met and had the rich experience. Although I had seen her in community meetings, we were never going to talk as openly as we did outside of this project. And now I can actually just call her or email her and get some advice on what does the research say about this or that? What's your experience with this or that? And so it really did help us to have some ongoing things. And if you go to the next slide, Karen, that's kind of where we can talk about how the research project is over, but we're continuing it, and it's actually thriving. So currently we're holding monthly support groups for our foster families, and as I mentioned, 30% of them will go on to adopt the kids that are in their home right now. So it is relevant to the adoption world. We started with the same mentoring training that we did for the research participants, and we in these monthly support groups, we just get one tip sheet, and it's a 1-page, usually tip sheet, and it's every single one is through the lens of adoption, through the lens of fostering. So it's mentoring, but it's mentoring people that are in your shoes in the adoption world. And we had a nice discussion about um, what you are and what you are not as a mentor. You are an advisor, but you are not a therapist. You don't have to be a superhero, and you need to know when to refer. That was one of the nice things that I learned about mentoring and could share with our people. And that goes on. I can have those conversations well after this project. Trauma in the brain. All of our families have been trained, but this was a group, a support group and training designed specifically for people that are adopting. Um, uh, and so it was very interesting to see trauma in the brain through that lens. And it was very interesting to see, along with grief and loss, that sometimes when you're adopted at birth, people really think that there are going to be no issues because you were adopted so quickly. And so we learned about, things that could happen in utero, and the loss of just a biological mother, even if you went on, like in my case, to have a wonderful family, how we can pay attention to that early loss, even if that's the only loss that is sort of visible. We talked about holiday and anniversary reactions. We did that right before this last holiday, and we hands-on helped people prepare to go through the holidays. And it was nice for them to talk to each other, and also get some data about why those things are difficult from Karen. Um, I think it's 90% with some of the research that Karen shared. 90% of children of color that are adopted by people of a different race. So it's really important to focus on this issue. Our program in this state is the only one also that does unaccompanied refugee minor foster care. Very rare for those to turn into an adoption, but we have 2. And so it's really important. Plus they live with kids from other races and adopted kids from other races. So this was a really good topic for our group, to make sure we understand. And we talked about how you need to be aware of your biases ahead of time, and be aware of what your child might face in the future so that you can prepare them and allow them to talk, and not just hope it's different because you've done something different. Um, and then finally, and just on the support groups, just because we wanted to highlight them because they were just so good for our families. The last one on FAS and ADHD, that was just a request. Dr. Barrett, could you please, this is from the parents that had already gotten to know her, could you put something together specifically on that? Because one family had 2 of their adopted kids and 1 child that they weren't going to be able to adopt, and they all had been diagnosed with FAS. And so they just requested, I was like, this is like ask a doctor, request what you want, and you're going to get some data about it. And then my job was kind of to take it then from the training piece into now it's a support group. And so it was just Dr. Barrett and I both sit in these training / support groups. And it was research and lived experience. Not that Dr. Baird also doesn't have lived experience, but her expertise is definitely in the research and in the teaching as a professor. So those were just really quality support groups. And, they literally are posted in my room, but I literally have all these tip sheets that will live on after the project, but they were developed based on work that was done with the project, and we're so grateful that we had funding to do that. I'll go now back to Dr. Barrett, just because we go into mixed method research, and I'm just not the person to talk about it.
So we have published one study in a good journal. It's a mixed methods journal article, and I think it's interesting that CCTSI Accords are doing that mixed methods webinar, because it does seem like it's an approach to methodology that's particularly relevant to this kind of a project. So we did do that, and we're currently working on a qualitative paper. And I'm doing that in collaboration with one of the original investigators on the focus groups, which were part of the needs assessment portion of the project. And what we're doing is we're looking further at those qualitative results from that focus group, and we're going to be trying to draw out the professional implications. And then Kim and I are going to be writing a practice piece that has to do that, something that will go to practitioners rather than researchers, that will elaborate on those qualitative findings and their implications for practice. So yeah, that's what those latter two current work pieces are.
Thank you.
All right, and it's not wanting to advance. There we go. So we just wanted to thank various folks, CCTSI, for funding these projects. And Becky Orsi-Hunt is the person who isn't here. She participated in the first grant, but not the second grant. And she is the person who is collaborating along with one of her postdocs on the qualitative re-exploration. We also want to thank our great grad assistants, and Kim alluded to some of those. And I think two of them have been involved in papers from this project also. And then we just wanted to be open to your questions.
All right. Well, thanks, Kim and Karen, both of you. Such a cool project, really important topic, and really appreciate your being with us today and giving us that overview. I'm gonna again encourage folks who have questions to put those in the chat. But while we're waiting on those, I've got a question for you guys. That one is, what I'm curious about is, I think for folks that are considering this kind of work, we like for them to know about what happens when things don't always go well. So when you guys had, a slight difference of opinion about how things ought to proceed, I'm guessing that probably happened. How did you guys work through that?
I can answer just because I want to encourage community partners to do this. The researchers are probably looking for these opportunities frequently, and it's some of their work, whereas a community partner may be doing this outside of their work hours, or whether they have funding or not. And so I want to encourage community partners to do this. For us, it goes back to, we developed a relationship, and it was not a Zoom relationship. It was a real relationship based on us being vulnerable and seeing each other time and again in person. And Karen and I, we do think differently about some topics, and that's perfect. That's to be celebrated. It was just so respectful, which is what we all do with each other. But if I had an idea, it was quickly incorporated into what we were doing. I hadn't thought of that. Just last night, I was personally talking to a foster family. They wanted to adopt a child. It's not going to work out. And there's grief, heavy, heavy grief, which sometimes looks like anger, towards Lutheran Family Services. And I navigated that. That story is something that I know that Karen wants to hear. I could share it with her, and we would figure out a way to put that somehow into a question, or make it part of at least at a minimum, a support group ongoing. So I think it's relationship based. You have to establish a relationship that can deal with the bumps that absolutely will come. But I hope that answers it. Karen, you were going to say something.
Yeah, I was just going to say, the other thing that was really great about working with a community partner is when we have these recruitment issues, I mean, Kim was connected with all of these different organizations that we could try to recruit from. And so we we had lots and lots and lots and lots of Zoom meetings with various different agencies and organizations to try to drum up business. It was really kind of great. And yeah, I think I agree with Kim that the fact of the matter was we really, really value each other's opinion and input. And so when we disagreed, that was good. You know, I think we both saw it that way, that it wasn't so much disagreement, it was bringing in a new perspective. And I just think it was really valuable. And we even had that when it came to the adoptive child versus the adoptive parent.
Mhm.
You know, sometimes I would say something with, you know, based on my lived experience as an adoptive parent. And, you know, I'd be saying this and that. And she'd say, well, wait a minute here. And I'd say, oh, I hadn't thought about that, you know. So it was really, I think it was great. That we could really, you know, help each other see some things that we just wouldn't have seen otherwise.
Yeah, that's great. Thanks so much. That's really helpful. We do have a question from our audience, which is for early career clinician researchers that are interested in forming a community partnership like this. Any suggestions for how to pursue that or find potential community partners?
Yeah, I mean, in terms of finding community partners, I guess that I'm trying to even remember, I think that we just had intersected because of our interests in this population. And
I
I think
remember.
Becky and you had connected over, she was doing another project on foster care, and she had connected with you that way. So we had like a couple of different points of intersection, and then we just started talking.
And I think my advice for academics who can get very busy within their walls of their universities, CSU does a great job, and both Becky and Karen were part of this regularly monthly meeting that was held by Larimer County DHS. They didn't always need to be there. It might not have all been relevant, but they were there as often as possible, forming those relationships with community members. And at that meeting was basically every provider in town that works with this population and others. And so they just got to know us. And then it's that humanity that can be found in person, where you start chatting and realize you have, you know, a common goal. And so I think that was the meeting we all met, Karen, and it's relational.
Yeah.
So you have to get out and into the community, whatever that community looks like in your neighborhood.
Yeah. Showing up sounds like, yeah, that's great. Another question from our audience. Projects come and go, as does funding, but relationships must be maintained. How do you keep relationships with community partners going after a project is completed and funding is depleted, or you're in that gap period?
Yeah, I mean, what we've done, we just really both have a passion for this work. And so we've just been doing these support groups, even though they're not funded. They're just on our own time, because we want to, and we want to share the materials and so on. And I think that helps keep it going. Kim and I still haven't managed to do our in-person that we're hoping to do sometime soon, but I'm going to be passing on some materials that were from the project to Kim, who's going to be able to then provide them to her parents and so on. Some of the materials we otherwise wouldn't be fully utilizing. So she's going to be able to use them to support Lutheran families, which is a lot of families, because it's a very large organization. So, you know, those little points of connection, we just try to keep them going. So I would say, you know, we talk to each other via Zoom at least once a month. and probably more than that. And like I said, we're going to be collaborating on this practice piece once we've got the data analyzed from the qualitative work. And that'll be a point where Kim's the expert, and she's going to know how to talk to practitioners better than I would ever know. So I think it's just, we really value it, so we keep it going.
Yeah, that's great. Couple of questions from Sarah. Curious about next steps. Do you see yourselves pursuing additional research in this area, or together with additional partners, or does it feel like this is pretty complete and how it's getting embedded into ongoing program at Lutheran Family Services?
Yeah, so that's a really great question. I think, you know, COVID did lots of different things. And one of the things it did in terms of my own personal professional life was I ended up deciding to retire. So I'm professor emerita, and that's what that means is, you know, I still am doing research, but I'm not doing it to the level that I was doing before I retired. So I think that reduces the probability that we'll go for a big grant to fund it again. But I do think that, you know, I'm actually still on a graduate students committee and things like that. So I have these points of intersection that hopefully can get some other future researchers inspired to do further work with this project.
Great. And then Sarah had a question for you, Kim. How do you fit this work into your professional role? Sounds like you're very busy. Research isn't typically kind of part of, you know, 501 nonprofit work. How did you make the case to spend time on this and fit it into your calendar?
Well, I think everybody's busy on both sides of the aisle. So having it be a personally moving part of your life helps. So finding a topic that you can connect to, because like a lot of people in the community, I get emails all the time. Would you do this, this, or that? And a lot of times it's a good luck, I can't. But it wasn't with this, and it might have been because it was adoption or my respect for Colorado State, where I send my son. It was an exciting opportunity because it was personal. How I convinced my boss, that's always just finesse, but but you know, I knew that our foster parents always need ongoing training hours. Any foster parent in the state needs 20 minimum, and sometimes up to 32 or beyond, depending on the level of foster care that you're doing. And so I knew that anytime they were mentoring, I could count it as state required hours. And that's one of our, you know, that was one of the things we could do for our families to meet needs on both sides. Um, Having the library, I would not have had the funding to create a library like Karen's going to allow me to create. If you go to our lobby, you'll laugh at some of the books. I think they were donated in 1970, maybe. I don't know. Words we don't use, and that someday I'm going to go in there and I'm going to get rid of some of this stuff that's probably just plain offensive, you know, but well intended in the 60s. And so knowing that I was going to get that and wouldn't normally have funding for it. And also just valuing education. So at Lutheran, I didn't have to finesse much to say, may we partner with actually multiple universities on something. They love to do that. And so I just made the time. There were times it wasn't funded, you know, and I wasn't billing my time to go to that coffee shop with Karen, but I wanted to. And so I made the time. I don't know if that answers it, but yeah, if it meets your people's needs and it meets your professional just juices, there's a real potential for something great.
And we were able to use some of the CCTSI funds to fund at least a little bit of Kim's time, which I think was good for her presenting it to the boss, you know.
I had salary, yeah, built in.
Yeah, I think that's one important thing, especially for our attendees, that we strongly encourage, and it often figures into the reviews, that there's adequate support for the community partner to engage in the work.
There was for my time, and not to interrupt you, Dawn, but also I had money to do incentives and thank yous for the participants. And foster parents and adoptive parents are always very grateful for those, those actual goods. And so it was my time, but it was also gifts I could give to our people.
Yeah, cool. Well, I'm going to pass the mic back to Sarah to close us out.
Well, first, I want to thank you both, Kim and Karen, for taking some time to share your experience and some expertise in how to approach these partnerships and these great mechanisms. So thank you so much for sharing with us today and answering a lot of detailed questions as well. For those of you attending today, I want to just let you know the recording of this will be on the website shortly. Please feel free to share that with your colleagues or others who are building partnerships as some great examples and resources. For those of you who are here, please take our survey, our evaluation. Jordan's just put that link in the chat, and that really helps us make sure that we're helping to support all of your development in these partnership spaces. I want to thank Ramona and Jamie today. This will be the last of our community engagement forums. They've been serving on our planning committee for the last year and a half, almost 2 years. And we are cycling in some new partners for the next academic year. And I just want to express to them how wonderful their partnership has been and how our last 2 years would not have been nearly as wonderful without all of the expertise and just everything they brought to the planning process. So thank you to Ramona and Jamie for being our partners in this process. And then just a reminder to everyone, our next community engagement forum, again, those are quarterly. So we will see you all July 26th, same lunch hour time slot. So thank you to all of you, presenters and attendees, and we hope to see you all again in July.